curfews. It depends on what their problem is, what their situation is, and what they're trying to solve, and we'd have to talk through it. So I'd have to understand what the theory of their action is.
There are reports that there's only a handful of people in the Comfort at this point. Can you give us an update of how many patients are in the ship, as well as in Javits Center at this point?
I do not have the numbers, Jesse, but I can get them for you. Those two facilities are operated by the federal government, as you know. They're for non-COVID patients. Only. The theory is that the non-COVID patients would come out of hospitals, freeing up more beds in the hospitals for COVID patients, and that the Javits and the Comfort would be a overflow valve for that. The federal government determines who comes in by their protocol, and but I have to get the numbers. I don't have the numbers.
Is it possible that the Javits and Comfort could have some point care for some COVID patients, like maybe not ICU level ones? Or?
They could. You would need the federal government to allow you to have Javits. Look, Javits Center can do, the Javits and Comfort can do whatever the military allows them to. I understand on the Comfort, they don't want to bring in COVID patients because that's an entire ship. How do you disinfect the ship afterwards? And that's a complicated situation. Javits, you could convert to a COVID facility. It would require the federal government to allow it. I don't know what kind of medical staff, COVID versus non-COVID, maybe Dr. Zucker would know.
So it really depends on their clinical condition. The COVID patients who are recovering are in their convalescent phase, and so they should be getting better and need some respiratory support from the standpoint of chest PT and nursing care more than anything else. And the non-COVID patients, obviously it depends on what their medical condition is, but obviously those individuals would have to be in relatively stable condition.
Governor, there are reports out of China that the coronavirus cases and deaths might not be accurate. I'm just wondering if that's true, if that would have any bearing, any impact on the models and the projections that we're using in the United States.
It's an interesting question. Part of what we do not do the models in-house. Right? We review the models, but we don't do the models. We have McKinsey does models, Cornell Weil does models, et cetera. It's a whole art form unto itself. The modelers will tell you they use Wuhan data, especially when they're trying to calibrate the rate of spread spread and the effect of social isolation. But they also have a lot of data post-China that they are relying on. You have South Korea, you have the rate of spread now here. So you raise a good point. If the China data was wrong, might it influence the model? Yes. But the model isn't solely dependent on that data either.
Ventilators from the federal stockpile have been faulty, either had missing pieces or were not working. Did New York receive any faulty ventilators?
Did New York receive any faulty ventilators from the federal government? We've received, the state overall, the city and the state, received 4,400. We have distributed many of them. I have not heard of any faulty.
I haven't heard of any.
So I think the issue is, and this was an article in the LA Times out in California, it was reported that some of the ventilators that were sent to them by the federal government were faulty. And the explanation is apparently you have to run ventilators ever so often. It's not unlike a car battery, not that this is my particular area of expertise, admittedly. And so that was what they chalked that issue up to. In New York, when we saw that report, we began to review our own stockpile, and we're in the process of doing that now of the ventilators we got from the feds, and we haven't seen a problem so far.
Are you expecting any more ventilators from the federal government at this point? Have you been informed that
You know
more
what?
are on the way? Or?
Where the federal government is very aware of our situation. I spoke to the president this morning. I worked with the vice president, the White House staff, et cetera. I don't think the federal government is in a position to provide ventilators to the extent the nation may need them. You know, I don't think it's a question that this federal government has ventilators that they're not distributing. They may have ventilators that they're not distributing now, on the same theory that I'm not distributing all of our ventilators now, because you have a stockpile, right? State has a stockpile, federal government has a stockpile. Concept of a stockpile is you stockpile until you need it. But I don't know if they have more in the stockpile. I know that the ventilator availability is just a problem for everyone. You have 50 states competing for it. You have the federal government trying to buy it. I don't know what their capacity is in their stockpile, but I wouldn't at all be surprised if they don't have enough in their stockpile to provide for all the communities that need it. That's why our attitude here is, you know, we're on our own. I will ask the federal government if we get to that point. I'll ask them. I'll plead. I'll do whatever I have to do to get ventilators from the federal government. But that's why we're also taking all those extraordinary measures ourselves. Just assume you are on your own in life, right? And that's the operating assumption. But having said that, I am sure the federal government would do anything they can do to help. There has been nothing in our relationship that would suggest they wouldn't do what they can do to help. The question is, what can they do? I don't know the answer to that question.
Any update on efforts for states to have a buying consortium where states work together to buy PPE?
No. I think you're past that point now because you just can't find the product. Zach?
Governor, could you compare the use of these bi-level machines to a regular ventilator, and how do the supplies of the bi-level machines compare to ventilators?
BiPAP versus a ventilator. It's a great question. I would love to respond to it, except I have no idea how a BiPAP relates to a ventilator besides the generic comment that the BiPAP does not have the same level of force, doesn't pump as much air as a ventilator. Beyond that, I do not know. but Dr. Zucker may know.
That was a good explanation. Excellent. The BiPAP system. Systems are basically, they don't have as much energy. To push air in, and that the the ventilators have many more capabilities of doing different types of respiratory. Support, but the BiPAP machine will be able to help. Many individuals once you convert over.
So would they be used? For relatively minor cases?
Well, I think that this is a condition which is going to change. As someone gets either better or worse. And I think sometimes people think you put them on one machine and then they stay on that machine, but you can move things around. You can put someone on a ventilator, they start to get better, and then you can sort of switch them to a BiPAP machine, and that may provide the support that they need at that point in time, and then you can move it to the next phase as well. So it's not a stagnant situation. A ventilator has more variability than the BiPAP machine.
Look, this is not an ideal situation, and this is not a standard medical protocol, right? Everybody's made that clear to me. In a perfect world, everybody would have a ventilator. And that's our first goal, and it's always been our goal. And, you know, I've been talking about ventilators since this thing started. But if we hit that apex and we run out of ventilators, then on the theory of you do whatever you can do, then we have all those series of measures. Take the ventilators from hospitals that don't need them, splitting the ventilator so you double the capacity of a ventilator, use a BiPAP machine on a patient who you can use a BiPAP machine. All of those measures go into effect because you have no option, right? You're going to be in a situation where literally, if the person doesn't have a ventilator, they die. You don't have a ventilator. Then come up with plan B, C, D, E, F, G, H, and that's what we have done. By the way, we even have a plan for I showed you, the handheld rubber ventilator that's just a bladder that is manually operated, and we purchased 7,000 of those.
President Trump said this morning that New York had gotten a late start, that it had gotten far more supplies than that, and then, in the next breath, said that Cuomo was working hard. How do you make a sense of the president's criticism of the state and praise of you?
I don't know. No. I don't know. I don't know how you square those two statements. I don't know that you can square those two statements. Got a late start on supplies. We started purchasing, and we probably will have wound up purchasing more than any state in the country. I will bet you dollars to donuts we wind up buying more ventilators than any state in the country. So we were very aggressive from day one, as you know. And again, that's on the assumption that each state is supposed to be managing this situation. But I thank him for his good words that he thinks I'm doing a good job. We're doing the best we can with all the special populations in prisons, in nursing homes, in homeless shelters.
There is a moratorium on evictions for the next 90 days. What happens after that? If tenants aren't paying their rent, should landlords evict their tenants after those 90 days? What would prevent them?
Yeah. Let's see where we are after 90 days. You know, a lot of these situations, what do we do about rent after 90 days? What do we do about income after 90 days? What do we do about infrastructure after 90 days? You know, so much of this is changing and fluid. I don't think anyone can sit here and tell you what the right plan is for any of these areas 90 days from now. I just want to get to 90 days from now and get there healthy. And then we'll handle whatever we have to handle.
Do you have any updates on those ventilators that you purchased from China? You said you were expecting 2,500
why is that changed?
We have not received, do you remember, Jim, Doctor?
It may be, we'll have to check whether they're going to be delayed because there have been issues, of course, with shipping internationally right now, but we'll get back to you on the exact answer of where they are on the 2,500.
Is there a number, what's the number right now of total ventilators we have, and how does with the BiPAP machines, does that bring us closer to, the target?
We have about 2,200 ventilators in the stockpile. That's what we have. Yes, 2,200 ventilators. The number of people who come in per night who need a ventilator is somewhere in the range, right, because it's a little different every night. But if you wanted to be safe, you'd say like 350 people come in every night who need a ventilator. So 2,200, you see, disappears very quickly. What do? Try to buy more ventilators, and then plan B, plan C, plan D, and that's what we've laid out. There is no state and no country that has done anything to provide ventilators that we are not doing. We've literally looked at everything that Italy did, China did, South Korea did, every other state. We're doing more than any other state or country has ever tried to do in terms of backup contingency plans. And, beyond that, every day we try to find more, buy more, and be more creative. Who hasn't asked a question?
Yes, thank you, Governor. You said yesterday at the end of your remarks that this virus will change people.
This is it's incredibly hard. It's incredibly difficult. My brother touched on it. I take my job very seriously, and I take my responsibility very seriously. And I don't make excuses. I don't, if I fail, I fail. If something breaks or something doesn't work, that's on me. I see those number of deaths every day, and I take that personally. And I feel the pain that families are feeling, and I'm doing everything I can, but people are still dying, and that is very hurtful and humbling and painful, just painful. And this is a long time to be under that level of pain. What do you look like when you come out the other side? I don't know. I don't know.
There is a company in Cohoes called Precision Valve and Automation that says they can make a contraption that automatically pumps a bag valve mask, the thing you demonstrated over the weekend, similar to a ventilator. That's something you've looked into, and is that something viable? That could be for Dr. Zucker.
Yeah, I don't know if they have looked into it, but if they haven't, we will.
Well, the new changes in the budget result in more people in jails amidst the outbreak. And did you look at facts and figures to see if a new change in bail law was needed?
Yes. Well, no and yes. No to the first part, yes to the second part. Have we looked at facts and figures? We've discussed this for 2 years intensively. There's been all sorts of conversations. As you know, I had a meeting in this room with all the interested parties like 10 days ago.
So I just mean the facts and figures
figures from the rollout of the law in January until now? Like, what do those facts and figures
yes.
tell you?
Yeah, everyone has been looking at the facts and figures and discussing and debating and analyzing. And there's been there's a range of opinion, as you know. On most matters, there's a range of opinion. And the bail reform that we did last year, I'm very proud of, because it was discriminatory in effect, if not in and in impact. And I think we made the right change now, and I think the improvements we made this year are the right ones also.
Governor, construction workers on projects that won't be done for a while, so LaGuardia Terminal, Moynihan Station, and affordable housing, are wondering why it's essential for them to keep working through the pandemic on these longer-term projects, especially sites that have had positive cases.
Well, essential projects are projects that are public works by and large that the state needs and the city needs. You know, after this is over, we're going to have to get back to work, and we're going to have an economy that functions, and having infrastructure is an essential part of that. And a lot of these projects, once you start, you can't just stop, you know. Those airports are still functioning. Planes are still coming in. And LaGuardia is a whole configuration of physical barriers and alternative routes pending construction. So a project like that would be very, very difficult to freeze and then unfreeze. Anyone who hasn't answered a question? Okay.
There's a fail-safe for the Emergency Bond Act, or for the Bond Act for Restore Mother Nature. How do you make the decision on whether or not to pull the plug on that and on sending it to the voters?
It's basically on finances, so I would ask Robert Mujica what he thinks.
We're going to look at access to the market. Access to the market is pretty limited right now. We're going to be borrowing to deal with the short-term revenue shortfall. But by next September, next October, we'll look at the state's finances at that point, look at our access to the market, and then make a determination then.
How likely do you think it is that you do have to pull the plug?
It's hard to tell how likely is it going to be that the economy is going to return to where it is next October. It's your guess.
What's the number in the total of short-term borrowing at this point? Is it $8 billion? Is that what we're looking at?
We're not sure yet, right? We're going to look at what the market will allow us to borrow, how much we have in reserve, and make that determination at this time, right? The shortfall between April and July 15th is going to be $10 billion. So it'll be somewhere between that number. We have some access to reserves that we have, so we'll make the determination then.
I'll tell you this, that the legislature and the executive got this budget or getting this budget done with all the initiatives that are in this budget is an extraordinary feat of government accomplishment. And I praise Speaker Heastie and Senate Leader Andrea Stewart-Cousins and every member of the legislature. You know, it would have been very easy to say, oh, this is an extraordinary year, let's just do the bare minimum and go home. They said the opposite. They said we have a lot of needs, there are a lot of issues that need to be addressed, and they stepped up to the plate and they did it. You look at that list of initiatives that are in this budget, you can put that budget against any budget that I have done in any normal year, and it would be a great budget. That it was done this year is really extraordinary. So I praise them for that. Anything I said that wrong, incorrect, misstated, don't be shy, now is the
I
time.
would just make the point that on bail, while there are additional crimes that are bail eligible, that's what they are, bail eligible, so it doesn't necessarily mean that it's going to translate into more people. And I believe the effective date is 90 days from now, so it takes into consideration the current circumstance that we find ourselves in. There were 115 crimes that we moved to be alternate to bail eligible, so things like remote tracking and treatment and other things. So there was a heavy emphasis on that as well in the bail reform bill.
Thank you, guys. Stay safe. Stay safe. Social distance. Did the who, I'm sorry?
MRT recommendations, do you know when those are going to be released?
Did the MRT recommendations get
Many of the
delayed?
MRT recommendations were, or are in the budget, which will be enacted. If the legislature votes for it, we have the ability to delay them in the budget. So the effective dates can be changed.
Should absentee voting be expanded for the June primary?
Something we're looking at. Happy birthday to you. Happy birthday to you. 18 years old again. Happy birthday.